A disease is said to be rare when it affects less than 1 in 2,000 people. Between 6,000 and 8,000 rare diseases have been identified. In France, 3 to 4 million people are affected, all diseases combined. Since 2004, France has therefore made rare diseases one of its public health priorities by implementing successive national health plans called National Rare Disease Plans (PNMR), Plan National Maladies Rares. After the first National Rare Diseases Plan, with the creation of the National Reference Centers for Rare Diseases, the second led to the creation of 23 rare disease health networks and to help healthcare professionals to better diagnose, treat and support people with rare diseases. The G2M network is led by a team which includes a medical coordinator, a project manager and mission leads. Its role is to promote the smooth running of the network's actions and to ensure their realization. In order to function well, our body needs biochemical reactions that take place in cells. A biochemical reaction is a conversion of compound A into compound B. Certain reactions thus occur one after the other to create what are called metabolic pathways. These reactions are made possible by a large series of specific molecules, enzymes and carriers. Inherited metabolic diseases are the consequence of a deficit in enzymes, carriers or other molecules involved in metabolic pathways. Metabolic diseases are classified into 3 groups according to their consequences on the body: diseases by intoxication, energy deficiency diseases, and complex molecule defects. Diseases by intoxication are due to the accumulation of compound A, which is not converted and becomes toxic to the body. This is where symptoms or signs of the disease appear. The group of energy deficiency diseases includes diseases with symptoms related, at least in part, to the failure of production, use or store of energy indispensable for cell function. Finally, complex molecule defects include diseases that disrupt the production or destruction of complex molecules. The presence and functioning of enzymes are determined from birth by the genes that are passed on by both or one parent. This is why we use the term genetic diseases. Metabolic diseases result from mutation or mutations in a gene encoding an enzyme or carrier, resulting in the malfunctioning or even missing of the latter, thus disturbing the metabolic pathway. While inherited metabolic diseases are individually very rare, they potentially affect a large number of patients. There are over 700 identified metabolic diseases, and new diseases appear regularly, sometimes difficult to classify, making correct diagnosis very hard. Moreover, in some patients, the symptoms are not visible. This is called an invisible disability, which can lead to incomprehension on the side of the patient's professional and personal entourage. Symptoms of metabolic diseases are extremely diverse. Several organs can be affected, such as the brain, the liver, etc. Some patients are forced to follow a very strict diet, where certain foods are completely forbidden, thus banned, and others have to be weighed. Not strictly following this type of diet can lead to the patient's hospitalization. Diseases by intoxication and energy deficiency diseases are at risk of acute decompensation or metabolic distress, especially in the event of fevers or intercurrent infections, which can occur at any age in various ways depending on the metabolic defect. Acute decompensation means a sudden disruption in the balance of the metabolic disease as a result of various triggers. The severity and clinical presentation of these episodes vary and may require urgent hospitalization of the patient, whether infant, child or adult. Some episodes can be avoided by providing appropriate and regular educational support for the patients, their parents, and caregivers. The G2M Health Network includes approximately 40 diagnostic laboratories whose involvement is essential to minimize the lack of diagnosis and to optimize care for the metabolic patients. Furthermore, there are 3 scientific societies, around 30 patient associations, research teams, along with reference and competence centers. The regional network consists of 18 rare disease reference centers and 47 rare disease competence centers across France, whose primary purpose is to take care of the patients in the closest proximity. These centers develop an expertise around groups of diseases such as inherited metabolic diseases, lysosomal diseases including Fabry disease, porphyria and rare iron metabolism, anemia, inherited metabolic liver diseases, Wilson's disease and other rare copper metabolism diseases, and hemochromatosis and other iron metabolic diseases. Actions are organized into 6 areas. Research, aiming at promoting contact and exchanges between caregivers, patients, research laboratories and data warehouses around therapeutic innovation and new treatments. Diagnostics, aiming at reducing diagnostic error and at encouraging more screening. Training and information for the general public, healthcare professionals and public authorities, aiming at improving patient care and raising awareness of the issues related to rare diseases. It aims also to intensify patient training and therapeutic education. Europe and international focus, aiming at strengthening collaboration with European reference networks and international rare disease networks. Health ethics for support and reflection on improving care practices and developing tools to help with diagnosis in children. Finally, assessment of the network's actions in order to monitor the progress of actions and improve the functioning of the network. In conclusion, the G2M network is at the service of patients with inherited metabolic disorders and brings together a large number of healthcare professionals, patient associations and research stakeholders. It attempts to do everything it can to improve patient care.